Hello everyone, welcome to Study Nursing by Sense Goals. Today in this video we are going to discuss about septic shock. This belongs to our short note series, so if you're interested, go ahead and check out our channels for more videos included in the series of your somebody preparing for the licensure examination. Do check out some of the related questions that include septic shock, because in fact this is a topic which is hotly dealt with in case of licensure examinations. All right, so in this video we are going to discuss about what is the meaning, what goes in through the disease, and what could be the clinical manifestation, and as a nurse what all management you could do, including the health education to the patient and the family. So let's quickly jump on to the definition. I wouldn't say it's a clinical definition, but it's an explanation. And in most of the official websites, that it includes the Cleveland Medical or the National Public Library of Medicine or even the National Health Services, NHS. The explanation is almost the same, but I've adopted it from the NHS site. So that says it's a life-threatening condition that happens when your blood pressure drops to a dangerously low level after an infection. So if you understand it well, you could be thinking about sepsis as well, right? When we are discussing this point. So imagine a patient having a bacterial infection. I say bacterial because most of the cases, bacterial infection are the common cause of sepsis. But even a viral or fungal infection such as candida could be rarely found. All right, so when the patient's infections goes untreated, the bacterial infection or the bacteria or the pathogen produces cytokinins that causes that releases toxins, and this toxins causes a lot of complications inside the human body. That includes widespread inflammations and stuff like that, which you're going to learn in the pathophysiology in the next slide. So talking about that, the sepsis, if they goes untreated, proceeds to the septic shock. All right, so these are the things that you might observe in a patient with septic shock. That includes low blood pressure and seriously dangerous level. All right, so when you see this in definition, you might be thinking about sepsis, but I hope I can release another video on sepsis soon. But right now we stick on to septic shock, so please don't confuse yourself with sepsis and septic shock. All right, so let's stick on to the septic shock. Right now you're viewing the definition or the meaning of septic shock. And this is characterized by low blood pressure. Always remember, septic shock, low blood pressure. Um, and pathophysiology. So as I've described earlier, that you have an infection, the infection goes uncontrolled, the toxins reaches all over the body, and it creates inflammations and toxins produced, causes clots in the body. It causes severe widespread inflammation that causes the blood vessel to dilate. As a result, poor tissue perfusion. And imagine you're having low tissue perfusion, none of the organs will get the blood, isn't it? So that's characterized by low blood pressure and organ failure, multi-organ failure, including kidney or the digestive system, say, or the neurological systems, including the brain, cerebral perfusion. Everything is shut down in this condition. Before I take you through the signs and symptoms, let me also explain you about the prognosis of the disease. Usually, septic shock has poor prognosis. Some of the data even shows that 70 to 75 percentage is the mortality rate. And once again, it depends on the kind of sepsis that the patient is having. For instance, if your patient has abdominal sepsis, then it's much lower that the patient will survive, and that's a sad thing to say or discuss, but yeah, that's the reality. So this condition has a poor prognosis. And let me take you through the signs and symptoms. If you're somebody who is coming to this video after watching the licensure examination question, you might be really feeling proud because we already discussed this in the other video. But if you're not, you're still not being late, but you still learning this in the right way. The signs and symptoms of the septic shock, try to remember in the pathophysiology what we discussed and try to relate. So when the patient or the when the body has low perfusion, you can observe low blood pressure, isn't it? And the body is trying to compensate it. The body is trying to actually give out the blood to all the systems across, and as a result your body can have increased heart rate as well as increased respiratory rate. All right, but at the same time you also discussed about decreased tissue perfusion and decreased organ perfusion. So when your kidneys have less urine, they usually produce less urine, so low urinary output. But speaking about which, there could be, you could be thinking which organ is the one to shut down first. In most of the cases it's kidney. So signs and symptoms: low urinary output. Think of the normal urinary output per hour in a normal adult in this situation. So I'm not going to give the answer because let's stick on to the topic septic shock here. Yes, so that being said, let's think of the cerebrum or the neurology. So when they have a less blood circulation to the brain, to the cerebrum, they have altered mental status that causes them confusion. They could be restless, all right? And of course, we discussed about the bacterial infections. So because of the ongoing infection, your patient can have increased signs of infection. Yeah, that includes a high temperature, and we once again come back to the lower tissue perfusion, right? So when the tissues are underperfused, including the skin, they could have cool and clammy skin, all right, or mottled skin. So these are the signs and symptoms of septic shock. Let me take you through the nursing management. I've included, single slides to make you understand better, or you simply find it easier to remember when you see some visuals in the slide. All right. So these are the points belonging to the nursing management. Let's begin with the early recognition. So three things that I want you to remember. The first one is you go to the patient, make sure that you assess, monitor the TPR, temperature, pulse, respiration, along with that oxygen saturation. So when you monitor the signs and symptoms early, when you monitor the vital signs, you get to know whether your patient is deteriorating or not. At the same time, number two, signs of infection, whether your patient has a high temperature, whether they have chills, whether they have increased WBC or white blood cell count, whether they have increased lactate in the blood, which indicates a tissue hypoxia. So these are the things that you as a nurse could be observing. At the same time, remember, always remember, in critical condition, urinary output. So monitor for the organ failure. We have a separate slide to explain to you what all things to include to support and monitor the organ system. All right. So in case of organ failure, early signs, make sure that you monitoring the urine output. All right. Just to quote the the most important things, um, and then the second slide, uh, it indicates the fluid resuscitation. So administer intravenous fluids, that includes the general IV fluids or even crystalloids rapidly to maintain blood pressure and perfusion, and monitor for signs of fluid overload, which is really important. That in most of the cases when they goes to shock, rapid infusions are intended, but at the same time you try to remember that the organs are not as smart as they were when this patient was a normal person, isn't it? So you check for the fluid overload. What could be the interventions, or what could be the things as a nurse you could be observing for fluid overload in a patient? Well, you can observe the fluctuations in the blood pressure. You can observe the vital signs. You can observe any crackles in the lung upon auscultation. You could also observe any swelling or edema in the patient. So these are the things that you could observe as a nurse for when you're looking out for fluid overload. And I always love the fact that we look onto the urine output. So remember, intake and output, you administer a lot of fluids and the kidneys are not able to went out in terms of an ideal urinary output. That also could indicate that the fluids is building inside the body. All right, so remember, in case of fluid resuscitation, you follow the orders and you help the doctors or the medical consultants prescribe, I mean, carry out the orders, but at the same time, as a nurse, observe for the signs of overload and escalate it to the medical management so that it's easier for them to just identify complication and treat accordingly. All right, and medication management, mostly they will have the IV fluids. They would have the antibiotics, which is generally intended to be started within an hour of diagnosis, and usually they are broad spectrum antibiotics. And they could also have the vasopressors, including norepinephrine, if the hypotension persists after fluid resuscitation. If you're somebody who is looking out to learning the drug study, feel free to check out the other videos belonging to the drug study. You could be really feeling good that you have that knowledge after being watched that video. All right, so these are the things that comes in the medication management for a patient in septic shock. At the same time, perfusion is really important. So have a look at your patient's saturation. If it is low, have a discussion with your consulting team and have an idea of what is the target saturation for your patient. Ensure that you maintain the saturation target by administering the oxygen as per the order. If they go on to the respiratory failure in some cases or most cases per se, they can have the they might want to require ventilation or intubation. So as a nurse, make sure that you have all the equipment for the intubation, an intubation set, or for the oxygenation set. The suction is got ready. Everything is ready for the patient. All right. um, and let's move to the next thing. I think mostly we have described or discussed the points, but for your easiness, I'll explain once again. When it comes to organ function, make sure that you catheterize the patient so that you have a direct access of monitoring. And most of the cases, the patients or the doctors puts, the doctors put the patient to IV fluids or enteral feeding, because in most of the cases they might not be conscious. If they are conscious, even they could have the risk of aspiration. So we usually find the other parts for the intake of the fluid. So you have the right access. Make sure that you're documenting the intake and the output accurately. That would help their treating team to have a clear look on the things. You could also monitor the lactate levels that indicates the tissue hypoxia, and in case of neurological function, you can assess your patient for any altered mental status. All right, so these are the things that you can do for or supporting the organ system. Let me take you on to the nutritional support. Administer supplementary, vitamins could be observed. Sometimes they could have, additional supplements that includes multivitamins. And as discussed earlier, they could also have nasogastric feeding. Um, Along with an ongoing IV support, IV fluid support. All right. So these are the things that comes in nutritional and hydration support of a patient on septic shock. Education, it's really important that it's easy for me to say in this video, but for you as a nurse, it could be tough. I know that. But educating them about the poor prognosis of the disease, and mostly it's done by the doctors in most of the cases. And you as a nurse, make sure that you're supporting them. And then sadly, uh, they might have to take a decision on whether to continue the a ventilator support, because despite having ongoing ventilation, some patients might find it difficult to survive. So in that case, not surviving to progress in a good way, but the progress might not be there. So in that case, you may want to support them with the decision. If the patient is conscious, then yes, you can, include. But if they are not, their family needs to make a decision. And sadly, yes, as a nurse, you may want to, support them emotionally in the decision making process. All right, so this is what it's included in the health education. So the key points when we are summarizing the topic here is early identification. Look out for the vital signs, deterioration or worsening symptoms, and once you have identified, escalate it to the team and have a look at what are being prescribed. Are they prescribing medications? Are they prescribing antibiotics, any fluids, any of the vasopressors for the starting, any of the bloods to be sent to the lab, or if they needs to be intubated, what are the things they need it, and you have it in your patient's side. Any oxygen needed, if yes, if you have any of the equipments really ready. So it means rapid, and then make sure that you're closely monitoring the patient. All right, so these are the things that is included in the septic shock. I hope you have got an idea on it. I wish you good luck, and I really thank you for your interest and staying with me till the end of the video. So that really shows your passion for the career. Good luck and see you in the next video.